The CDC has identified a case of coronavirus in Washington state, the Wuhan. Are the words about a pandemic at this point?
No, we're not at all, and we have it totally under control. It's one person coming in from China. The virus. They're working hard. Looks like by April, in theory, when it gets a little warmer, it miraculously goes away. I hope that's true. Because of all we've done, the risk to the American people remains very low. So far, we have lost nobody to coronavirus in the United States. Nobody. And it doesn't mean we won't. Our country is prepared for any circumstance. We hope it's not going to be a major circumstance. This is the most aggressive and comprehensive effort to confront a foreign virus in modern history. Anyone can be a carrier for the virus and risk transmission to older Americans and those with underlying health conditions and those who are most at risk. They have not done very well. So I'm glad to see that you're practicing social distancing. That looks very nice. And this afternoon, we're announcing new guidelines for every American to follow over the next 15 days. This is a pandemic. I felt it was a pandemic long before it was called a pandemic. All you had to do is look at other countries. I view it as in a sense, a wartime president. I mean, that's what we're fighting.
What do you say to Americans who are watching you right now who are scared?
I say that you're a terrible reporter. That's what I say. The American people are looking for answers, and they're looking for hope. America will again and soon be open for business, very soon. We cannot let the cure be worse than the problem itself. We're not going to let the cure be worse than the problem. Ultimately, the goal is to ease the guidelines and open things up to very large sections of our country as we near the end of our historic battle with the invisible enemy. We will be extending our guidelines to April 30th. To slow the spread. This could be a hell of a bad 2 weeks. This is going to be a very bad 2 and maybe even 3 weeks. This is going to be 3 weeks like we haven't seen before. We're starting to see light at the end of the tunnel. Can never be happy when so many people are dying, but we're going to be very proud of the job we did to keep the death down to an absolute minimum, the least it could have happened. The President of the United States calls the shots. If we weren't here for the states, you would have had a problem in this country like you've never seen before. We were here to back them up.
Has any governor agreed that you have the authority to decide when their state
I haven't asked
back up?
anybody because I don't. You know why? Because I don't have to. My administration is issuing new federal guidelines that will allow governors to take a phased and deliberate approach to reopening their individual states. We would have had millions of deaths instead of. It looks like we'll be at about a 60,000 mark, which is 40,000 less than the lowest number thought of. I think what happens is it's going to go away. This is going to go away. And whether it comes back in a modified form in the fall, we'll be able to handle it. We'll be able to put out spurts. And we're very prepared to handle it. We may be talking about 95,000 people ultimately. We may be talking about something more than that. One person isn't acceptable, let alone perhaps 100,000. I want our country open too. I want it open safely, but I want it open. Don't forget, people are dying the other route. You look at drug addiction, you look at suicides, you look at some of the things that are taking place, people are dying that way too. You can say what you want about the flu, but I've never lost anybody to the flu that I know. I've lost 5 people that I know. 2 people were very good friends of mine. But I think we would have had anywhere from 10 to 20 or 25 times the number of deaths if we didn't act the way we did, and also if we didn't act swiftly.
We're not going to control the pandemic. We are going to control the fact that we get vaccines, therapeutics, and other mitigation
Why aren't we going to get
areas
control of the pandemic?
Because it is a contagious virus, just like the flu.
Yeah, but why not make efforts to contain it?
Well, we are making efforts to contain it.
By running all over the country, not wearing a mask?
Jake,
that's what the vice president's doing.
We can get into the back and forth. Let me just say this, is what we need to do is make sure that we have the proper mitigation factors, whether it's therapies or vaccines or treatments, to make sure that people don't die from this.
The U.S. had more than 83,000 new cases yesterday.
More Americans hospitalized, more new infections, more lives lost. The average number of new cases in the U.S., now nearly 69,000 a day.
We're looking forward to a number of record weeks in the very near future that will drive this daily rate above 100,000.
37 states reporting an increase in new cases over the past week, 21 posting their highest 7-day averages to date. South Dakota's positivity rate for tests returned on Monday, 23%.
Literally, we've never given up on a virus like this before.
With no national plan, experts are working overtime to fill the void.
If people are not wearing masks, then maybe we should be mandating it.
Former FDA Commissioner Dr. Scott Gottlieb pushing for a temporary nationwide mandate in a new op-ed, noting states should be able to choose how to enforce a mandate, but the goal should be to make masks a social and cultural norm, not a political statement.
We actually have a narrow window of opportunity right now to stop the explosive spread that is coming.
Pennsylvania's Secretary of Health urging residents to limit all holiday gatherings.
We need to think about more and more gatherings being virtual or only staying with your family that you live with.
4 confirmed cases at this Arizona middle school, prompting a 2-week quarantine for hundreds of students and staff. Chicago adding a new curfew as numbers there rise. Illinois' Director of Public Health breaking down over the weekend.
We are reporting 3,874 new cases for a total of 33 confirmed cases since the start of this pandemic. Excuse me, please.
The Utah Hospital Association warning it may soon need to ration care.
That would affect not just people who have COVID, but people who need to go to the ICU for other medical purposes.
El Paso, Texas, adding a 2-week curfew as hospitals and ICUs reach capacity.
We've had significant spikes to the point that our hospital capacity is really tapped. We're probably at the end of our rope there.
The convention center being converted to a hospital to help manage the surge, which shows no sign of slowing.
It's kind of semantics. You want to call it the third wave or an extended first wave. No matter how you look at it, it's not good news.
The Vice President is campaigning today in North Carolina despite multiple of his aides testing positive. Do you think he should suspend his travel? And then secondly, Trump Chief of Staff Mark Meadows basically said on CNN today that we are not going to control the virus and instead pitch to mitigation factors like vaccines. What's your response?
They are admitting defeat, and I've been saying that, and Joe Biden has been saying that since the beginning. This is the greatest failure of any presidential administration in the history of America. And he went on to say you can't control it like the flu. And yet again, they're suggesting to the American people that this is like the flu, when we have known from the beginning, and they knew since January, that it's 5 times more deadly than the flu. Here in Michigan alone, over 3,000 new cases just yesterday. This week alone, nationally, we are breaking records for the number of people that are contracting a deadly virus. And this administration fails to take personal responsibility or responsibility in terms of leading the nation through this dangerous and deadly mass casualty event. And that's why they have forfeited their right to a second term in office.
And should Mike Pence suspend his travel?
Listen, he should be following the guidelines. We're doing it. I think we have modeled the right and good behavior, and they should take our lead.